pregnant ladies is a very different category because now you have two people you're thinking about rather than one. So whenever you're looking at topical treatments, most of the topical treatments do absorb inside. So especially during the first trimester is not something that I would recommend to most hyperhidrosis treatments because most of them have aluminium chloride salts. Most of them do say that you have to weigh the benefits and effects. So especially the pregnancy is not something, during the pregnancy, if the hyperhidrosis is not something so bothersome, then I would not be even thinking about those things. Now, whenever you're looking at pregnancy, always think about what are the side effects, not just to the mother, but also to the baby as well. Always start with something very topical, all right? So something, for example, like I told you, the antiperspirant gels have very minimal chemicals, very minimal of any side effects. Start with those. Let's say, for example, if it doesn't, then start with maybe, for example, ionotrophoresis. However, I would not recommend it because you see the idea behind that is you have some electricity running through you in general principle. So imagine that current running through your baby as well, all right? So there is, yes, to some people, and it is still debatable. I would not advise it unless some other data comes about. You see, we definitely need more research in such aspects of treatments. And whenever research comes about and you read about better papers, you understand better. So it's always something that is dynamic. It will change your opinion on the matter based on the new facts that you are given. So it is something that we may look into itself, definitely. But now let's say, for example, if it's just mild, do the other things that would actually be non-medical to actually improve your sweating. For example, loose cotton clothing, all right? Showering with different kinds of soaps. Using the antiperspirant gels, keeping your area or cooler. Most of the times hyperhidrosis is emotionally triggered, so keeping the emotions in control. Things like that would definitely help the hyperhidrosis, yes. But with pregnant mothers, it has to be individualized. I would not say it as a generalized principle. You have to know what the patient is, and like the way you say, geographical location as well. So that I would definitely consider one patient at a time rather than just being a blanket. Let's say, for example, she decides to breastfeed and expectorate the milk. So let's say, for example, if she applies it and then, she does the feeding and then applies it, then wait for a couple of hours and then again she feeds. So with that kind of leeway, then you're also thinking, is it possible to use or not? So it would be very individualized. But now you see, you also have to think the baby is also feeding, how frequent will be the feeding and things like that.